from Dr. AG Skin and Hair Transplant Clinic. So we do a lot of hair transplant procedure. Now we are also doing certain cosmetic procedures like this Botox injections. The Botox is basically, this is just to avoid the dynamic wrinkles. See, in the face you have two types of wrinkles. One is that dynamic wrinkles. When you do some act, so that time you will see some wrinkles. Suppose if you elevate the forehead, you can see the forehead wrinkles. If you show an angry face, you can get the glabellar folds. So if you laugh, you get in a crow feet. So all these are called dynamic wrinkles, and all these things will affect the beauty of the face. So if somebody has no wrinkles and somebody has the wrinkles, then you can make out the differences. Those without wrinkles, they look much better than those with wrinkles. So the wrinkles always shows a sign of aging. For that, we have come out with a wonderful treatment called Botox injection. So this Botox injection main action is that it will prevent the nerve stimulation of the muscles, like it will block the acetylcholine. Like, see, these are all molecular level of understanding. Okay, so when acetylcholine is not supplied to the muscle will not act. So that will get deactivated. For example, I'll show you my face. If you blink, the action is from orbicularis oculi. See, this orbicularis oculi is the muscle around the eyes. There are two parts. One is this palpebral part and this is an orbital part. So what is the function of this orbicularis oculi? So it will close the eyelid. Okay, it depresses the eyebrow. Then you might see this the side crow feet. So all this is because of this orbicularis oculi. And if you deactivate this muscle, or if you do a temporary inaction or temporary paralysis of this muscle, I don't want to tell that paralysis, it is temporary deactivation of the action of this muscle. What will happen? There will be a disappearance of the crow feet. There will be elevation of the eyebrow. And this is called glabellar complex. If you inject Botox to this glabellar complex, when we show the angry face, now you get a fold. That's a dynamic fold. It will disappear, and the face looks flat with a good skin, tight skin. So that gives the beautiness to the face. So we have done this eyebrow lift with this Botox. You don't need any surgery for the eyebrow lift. Okay. So what we have to do is that we have to inject few units of Botox to the orbicularis oculi muscle, lateral to the pupillary line. It's very important, see, because if you go to medial to the pupil, then there will be a muscle called levator muscle, which elevates the eyelid. So that should not be affected with this treatment. So orbicularis oculi is a very superficial muscle, which is there just below the fat around the eyes. So you just inject tiny units of Botox into this muscle. So this will inactivate the portion of the muscle, so that what will happen, eyebrow will not be pulled down, so it will be elevated. And this is the frontalis muscle. What you see on the forehead is the frontal. That's the only muscle there in the forehead. So the main action of the frontalis muscle is to elevate the eyebrow. So what we do in the eyebrow, it's a very technical thing. What we do in the eyebrow elevation is that don't inject the lateral part of the frontalis muscle. So if you don't inject the lateral part of the frontalis muscle, this will be active and it will elevate the lateral side of the eyebrow. It's called brow lift. So this will elevate, the frontalis action will elevate, and you paralyze this, inactivate the medial part of the muscle, frontalis muscle. So leave out the left part of the muscle, lateral part of the muscle, and inject partially, with the tiny units, you inject the frontalis muscle so that it becomes inactive. And here, the corner of the eyebrow, the left, on the lateral side of the eyebrow, you inject few units of Botox, so that the particular area of the muscle of the orbicularis oculi becomes inactive. So when this becomes inactive, and when the frontalis muscle becomes active, so frontalis muscles will pull the eyebrow, it lifts the eyebrow like this, and it lift it in the more than the normal lift, because we have made this orbicularis oculi inactive. It's very important. So this part of the orbicularis oculi is inactive. Because of that, this eyebrow will get lifted and gives an arc shape that looks wonderful for both men and women. So it's more common, more popular in female, because many people will ask for the eyebrow lift. So it can be done surgical and non-surgical. So this is the best way for treating without surgery. No need for any blade or cut or sutures. And important thing is that this is a temporary, like it will last for 6 to 7 months. Then you can repeat the same procedure. The Botox, you know that it's a worldwide, it's a very popular injection. They inject for glabellar fold, the forehead, bunny nose, then the If you have a gum show, if somebody has there's laugh, if the gum is visible, so it doesn't look nice. So that we can, orbicular is the oris muscle. If you do little injections, so that will also disappear. Well, there are a lot of Botox injections we are using for a lot of the other things also, especially in the face. And also in case of the excessive sweating on the palms, we inject this Botox injection. That's wonderful results. There will be immediate stoppage of the sweating. Again, it lasts for 6 months. Then again, you can re-inject. Like excessive hyperhidrosis of palm and sole. This is the one. This is the best treatment. Where there are surgical treatment, that is a different. That's a different area. So if somebody wants non-surgical treatment for eyebrow lift, or to avoid the crow's feet, or to flatten the forehead wrinkles, dynamic, not the static, dynamic wrinkles and glabular dynamic wrinkles, bunny nose or gum show. So all these things, masseter hypertrophy. If somebody has a very strong masseter, we can decrease the thickness of the masseter. So these are multiple uses of Botox, and it is one of the safest. Botox is one of the safest treatment. We will not see any much side effect. The only thing is it's expensive and it is a temporary. Wherever we use it, just lasts for 6 months. So we can repeat the injections. Thank you.